Dear students, welcome back. In the previous session, we have discussed about optimal posture and its alignment, where the LOG falls in different segments in the body. What happens if LOG falls in front of the joint axis as well as on the back side or the posterior aspect of the joint axis, what is happening in different segments we have discussed in the previous session. And also we have discussed some of the opposing forces, that is passive opposing forces and the active opposing forces for the gravitational moment, also we have discussed in the previous session. Now in this session we are going to discuss about deviations from optimal alignment. We are going to discuss this deviation by seeing the posture on the lateral view. Okay, so that means we can simply call it as sagittal analysis of the optimal alignment. What are the deviations from the optimal alignment we can see in this session. So first, what happens if this deviation is happened from optimal alignment? Normally, reduction of energy expenditure and stress on the supporting structures is the primary goal of any posture. Okay, so any change in position or malalignment of one body segment will cause changes to occur in other segments. Okay, so changes in normal alignment increase stress, that is called as increase per unit area on the body structure. Okay, here stress means increase force per unit area on body structures. If stresses are maintained over for a longer periods of time, the body structures may be altered. So that means the posture is going to change. So then the muscles may lose sarcomeres if it is held in shortened position. For example, if you take knee, so this one is the shortened position of the knee. So then what happens? Here it lost the sarcomeres which is present on the posterior aspect, and thus the abnormal posture also prevent the full range of motion from taking place. Muscles also may add sarcomeres. So for example, in this posture only, the opposite side muscles are going to lengthen. So here what happens? The sarcomeres are added up in the lengthened position, and thus the muscle length tension relationship will be altered. And shortening of the ligaments will limit normal range of motion, while stretching of the ligamentous structures will reduce the ligamentous ability to provide sufficient tension to protect the joints. Okay, so prolonged weight bearing stresses on the joint surfaces cause deformation of the cartilage and also which interfere the nutrition of that cartilage. So as a result, the joint surfaces are susceptible to early degenerative changes. Okay, so in this session we are going to discuss about the deviations in the different segments of the body. Okay, so and another important thing, so any deviation from normal alignment of one or two body segments causes changes in other segments. So if there is any change in the ankle, it is going to show changes in the other joints. Okay, so and the amount of energy required to maintain erect standing posture is also increases. Okay, Postural problems may originate in any part of the body and cause problems all along the kinematic chain. Okay, so therefore it is important that the evaluator should determine the cause of the problem, where the actual problem exists. So we have to identify that one as an evaluator. So now we are going to discuss from foot to head what are the deviations from optimal alignment is going to takes place. So the first thing we are going to discuss is from the foot and toes. So here there are two deviations from the optimal alignment we can see in the foot and toes. So in the toes we can see claw toes. This one is claw toe and this one is hammer toe. So claw toes is a deformity of the toes characterized by the hyperextension of the metatarsophalangeal joint and combined with the flexion of the proximal interphalangeal joint and distal interphalangeal joints. So hyperextension and flexion at both the interphalangeal joints. Here what happened? This causes the abnormal distribution of weight may result in callus formation under the heads of the metatarsals. Okay, and also under the end of the distal phalanx. Sometimes proximal phalanx may subluxate dorsally on the metatarsal head. Calluses may develop on the dorsal aspect of the flexed phalanges. So, dorsal aspect of flexed phalanges. And from constant rubbing on the inside of shoes. That means this callus which are formed on the phalanges which are due to constant rubbing on the inside of shoes. Okay. So, what is the effect here means? This condition reduces the area of base of support. This condition reduces the base of support. As a result, what is going to happen? There is an increase of postural sway. Postural sway is going to increase in this condition and it causes decrease in the stability during standing position. Okay, so now we will see the another condition or deformity or the deviation from optimal alignment is the hammer toe. This hammer toe is described as hyperextension at the metatarsophalangeal joint. That is called as hyperextension here, and flexion of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. So what is happening here? Callocytes may be found on the superior surface of the proximal interphalangeal joints over the heads of the first phalanges, which is as a result of pressure which is coming from the shoes. Okay, the tips of the distal phalanges, also may show callocytes as a result of abnormal weight bearing. The flexor muscles are stretched over the metatarsophalangeal joints and which are going to shorten here. Okay, and also shorten over the proximal interphalangeal joints also. The extensor muscles are shortened over the metatarsophalangeal joints. At this point, because it is hyperextended, so the extensor muscles are shortened over the metatarsophalangeal joint and stretched over. So here this one, the extensor muscles are stretched over the proximal interphalangeal joints. If the long and short toe extensors and lumbricals are selectively paralyzed. The intrinsic and extrinsic toe flexors acting unopposed will buckle the proximal interphalangeal and distal interphalangeal joints, which causes the hammer toe. So this is the thing happening in the hammer toe, which reduces the stability in this condition also. Okay, now we will move on to the next segment, that is knee. So in the knee we can see one kind of deviation, that is flexed knee posture. So this is the flexed knee posture. In this posture, the LOG falls posterior to the knee joint axis. Here we can see posterior to the knee joint axis. The posterior location of the gravity line creates a flexion moment. So flexion moment of the proximal segment, that is here femur is moving on the posterior aspect, which creates flexion moment because of the LOG which is falling behind the joint axis. Okay, so here the flexion moment at the knees is happened, and this has to be balanced by the activity of the quadriceps muscles to maintain the erect posture. Normally, the quadriceps force required to maintain equilibrium at the knee in erect stance increases from 0 with the knee extended to 22% of maximum with the knee in 15 degrees of flexion. So from 15 degrees of flexion, the knee has to spend their energy from 0 to 22%. Okay, so because here the knee flexion is increased here, so rapid increase in the amount of quadriceps force is required to balance between 15 to 30 degrees of knee flexion. When the knee is in 30 degrees of flexion, the necessary quadriceps force reaches to 51%. Okay, it is going to reach up to 51%. The increase in muscle activity needed to maintain a flexed knee posture subjects the tibiofemoral and patellofemoral joints to greater than normal compressive stresses. So in the patellofemoral joints and tibiofemoral joints, what happens? The compressive stress is going to increase. Okay, if you see the other consequences of the knee flexed erect standing posture are related to ankle and hip. What happens at the ankle? So due to knee flexion, which is also accompanied by hip flexion, and at the ankle it is accompanied with dorsiflexion. Because what is happened here? Because of flexed knee posture, you can see the LOG which is falling anterior to the joint axis. So that means it creates dorsiflexion moment. That is called as here dorsiflexion of the proximal segment, that is tibia is moving anteriorly. So here the foot is fixed, only the tibia, the proximal segment is moving, which is also creating the dorsiflexion. That means the angulation between the foot and the tibia is decreased here. Okay, so that is the thing happened. And at the hip, the gravity line will fall anterior to the hip joint axis, you can see here. So which causes flexion moment. Okay, flexion moment at the hip joint is taking place, that is the proximal segment. What is the proximal segment? We'll get the hip bone, that is pelvis will undergo this flexion moment. Okay, so to maintain the balance of all these joints, first we will see at the hip, the hip extensors may be necessary. Hip extensors may be necessary to balance the flexion moment acting around the hip, and increased soleus activity, that is plantar flexion. Increased soleus activity may be required to counteract the increased magnitude of the dorsiflexion moment of the ankle. So the additional muscle activity subjects to the hip and ankle joints to greater than normal compression stress. Okay, so this is the thing happened in the flexed knee posture. Now we will move on to the another segment, that is hip. So before seeing the segment of hip and pelvis, we can see another condition which is related to the knee, that is deviation from the optimal alignment. We have seen the flexed knee posture. Now we are going to see the hyperextended knee posture here. So the hyperextended knee posture is one in which the LOG located considerably anterior. So the LOG will falls anterior to the knee joint axis. The anterior location of the LOG causes an increase in the external extensor moment. So what is going to happen if LOG falls like this? The femur will, the proximal segment will move anteriorly, which causes hyperextension at the knee joint. So and also because of this thing, it puts some extra pressure on the posterior joint capsule, which is going to be under considerable tension stress. So on the posterior side we can find the tension stress. A continual adaptation of the hyperextended knee posture is likely to result in adaptive lengthening of the posterior capsule and the cruciate ligaments. That means on the posterior side, structures are going to lengthen if this posture is continued for a longer time, and therefore it becomes a more unstable joint. And the anterior portion of the knee joint surfaces on the femoral condyles and the anterior portion of the tibial plateaus will be subject to abnormal compression and therefore are subject to degenerative changes of the cartilaginous joint surfaces. The length tension relationship of the anterior and posterior muscles may be altered, and the muscles may not be able to provide the force necessary to provide adequate joint stability and mobility. Okay. So the hyperextension at the knee is usually caused either by limited dorsiflexion at the ankle or by fixed plantar flexion position of the foot and ankle called as equinus. In that condition also we can see the hyperextension. Okay. So and some of the habits which are formed in childhood, in which the child or adolescent always elect to stand with hips and knee hyperextended in the relaxed or sway back standing posture. We can see here that sway back standing posture. So here this one. So this is the hyperextended knees and the hip. This is the sway back. In the sway back posture, from the optimal position you can find the deviations. One is a forward head with extension of the cervical spine, a backward displacement of the trunk and with an increased kyphosis, flattening of the lumbar spine we can find, and which is also causes posterior pelvic tilt and hyperextended hips and knees. So because of the habits from childhood, such kind of posture can be seen in adults. So now we are going to discuss about pelvis. What is going to happen? What are the deviations in the pelvis? So here we can find excessive anterior pelvic tilt and excessive posterior pelvic tilt. Okay, so in the case of excessive anterior pelvic tilt, here the pelvis tilts forward. The pelvis is going to tilt forward. The lumbar vertebrae are forced anteriorly. So because of this, the lumbar vertebrae are forced anteriorly, thereby increasing the anterior convexity, that is lordotic curve is going to increase. Therefore, the LOG falls at a greater distance from the joint axis. So this LOG, normally it is fall on the vertebral bodies. Now it is falling far away from that joint axis. So which creates an extension moment. So because of this LOG falling away from the joint axis, which creates extension in the lumbar vertebrae. Okay. So therefore, well, we can see some other changes in the other joints which are proximal to the lumbar and distal thing. So here this vertebral column is a closed kinematic chain, because the change in the lumbar curvature which also causes compensatory changes in the thoracic. That means there is an increased kyphosis, and which leads to increased lordosis in the cervical spine. These are the things which are going to takes place in the pelvis. Okay. Yes. Now another one is the excessive posterior pelvic tilt. A posterior pelvic tilt causes straightening of the lumbar spine, and also there is a subsequent loss of flexibility. It also causes some loss of stability or ability of the vertebral column to withstand a high load when the lumbar spine had a normal lordosis. So it is not having enough ability to withstand high load in straightening of the lumbar spine. In the straightening of the lumbar spine, we are going to see in excessive posterior tilt. So normally what happens if increased lumbar curvature in the anterior pelvic tilt? So there may be a tensile stresses on the anterior aspect and compressive stresses on the posterior aspect. Now we are going to see what are the structures which are going to compress here. That is, posterior vertebral bodies and interdiscal pressure of L1 and S1 is going to increase. If you see the distraction, so normally the lumbosacral angle is going to increase, and shearing forces at L5, L1, S1 is increased. So because of this, there may be a slippage of L5 vertebrae on S1. That is, slipping can be happen in this excessive anterior tilt of the pelvis. So what are the internal forces which are going to affect here is, we can see the stretching of the abdominals and shortening of the iliopsoas muscles in the excessive anterior pelvic tilt we can find. Okay. So this is the thing happened due to excessive anterior pelvic tilt. So we have seen that some of the changes which are occurring in this segment also leads to changes in the remaining segments. That is, we are going to see now the changes in the vertebral column. Okay. So we can see in the vertebral column, that is kyphosis and lordosis. The term kyphosis refers to the normal posteriorly convex structures or convex curve, that is thoracic and sacral regions of the vertebral column. Sometimes an abnormal increase in the normal thoracic posterior convexity may occur. This may increase. So, and this abnormal condition is called as kyphosis. So, for this condition, there is a compensation increase in the normal lumbar curve as well as the cervical also. Okay. So, the kyphosis may develop as a result of poor postural habits or osteoporosis. So, we can find here two conditions. One is Dowager's hump and Gibbous deformity. So, this Dowager's hump usually occurs as a result of compression fractures, osteoporotic vertebrae. So, Gibbous is a deformity may occur as a result of TB, which causes vertebral fractures. So, in this condition, we can see another one, that is forward head posture we can see here. So, so many relations are related here. So, a simple thing here you have to observe is, so in the case of thoracic kyphosis and what you can call it as lumbar lordosis and cervical lordosis, the structures which are going to increase the convexity, on that side the structures are going to stretch or lengthen, and both for muscles as well as the ligaments, and the structures which are present on the concavity side are going to undergo this compressive stresses. So, what are the structures which are going to affect? You can see in your books. Okay, I have explained in the excessive anterior pelvic tilt. You can follow the same thing for the remaining conditions. Okay, so these are the things we can see in the optimal deviations from the optimal alignment. So, in the forward head posture, normally the LOG, the anterior location of the LOG causes an increase in the flexion moment, which requires constant isometric muscle tension to support head, and stretch of suprahyoid muscles pulls mandible posteriorly into retrusion. Okay, so these are the things which are going to happen in the deviation of optimal alignment. In the next session, we are going to discuss about this optimal alignment and analysis in the anterior and posterior views. Thank you.